people experience slight redness that resolves within hours. Superficial peels are appropriate for mild acne, texture concerns, and maintenance. Monthly superficial peels combined with home treatments provide excellent acne management. Medium-depth peels penetrate into the dermis, providing more dramatic results but requiring more recovery. These use higher acid concentrations, 35 to 50% glycolic acid, TCA at 25 to 35%, or combinations, and require 3 to 5 days of significant peeling and flaking. Medium peels are appropriate for moderate acne, significant scarring, and hyperpigmentation. Results are more dramatic than superficial peels but carry higher complication risks. Most people perform medium peels quarterly rather than monthly. Deep peels penetrate deeply into the dermis, providing maximum results but requiring significant recovery time. These use very high acid concentrations, TCA at 50% plus, or phenol. Recovery takes weeks, and results are essentially permanent in terms of skin transformation. Deep peels carry significant risks and are rarely performed for acne specifically, being more appropriate for severe aging or significant scarring. Most dermatologists reserve deep peels for carefully selected cases. Laser treatments use focused light energy to treat acne, scarring, and pigmentation. Different wavelengths target different structures. Ablative lasers, CO2, erbium YAG, remove skin layers through vaporization, providing maximum results but requiring weeks of recovery. Non-ablative lasers penetrate without removing skin, requiring less recovery but multiple treatments. Fractional lasers treat portions of skin, leaving untreated skin to support healing, requiring less recovery than full laser treatment. For acne specifically, fractional non-ablative lasers are most commonly used. These provide acne improvement through collagen remodeling and pore minimization without severe downtime. Typical treatment plans include 4 to 6 treatments spaced 4 to 6 weeks apart. Results appear gradually over months as collagen remodels. Fractional laser is excellent for acne scarring, pore size reduction, and texture improvement. Cost is typically $300 to $800 per treatment. Blue light therapy uses specific light wavelengths, around 415 nanometers, to kill acne-causing bacteria. Treatments are painless, require no downtime, and are suitable even for sensitive skin. Most treatment plans include 8 to 12 treatments performed twice weekly. Blue light is particularly valuable for antibacterial acne treatment without systemic antibiotics. Cost is typically $75 to $150 per treatment. Photodynamic therapy, PDT, combines a photosensitizing agent, topical aminolevulinic acid or methylaminolevulinate, applied to skin with subsequent light activation. PDT kills bacteria, reduces sebum production, and improves acne. Treatments are followed by 24 to 48 hours of photosensitivity and significant redness. Results are dramatic but require recovery time. PDT is reserved for severe acne resistant to other treatments. Radiofrequency, RF, treatments deliver radiofrequency energy deep into skin, stimulating collagen, reducing sebum production, and improving acne. Multiple treatments are necessary, typically 4 to 6 treatments spaced 3 to 4 weeks apart. Radiofrequency is gentle, requires no downtime, and is suitable for various skin types. Results include both acne improvement and skin tightening. Microneedling creates controlled microinjuries triggering collagen production and skin remodeling. For acne, microneedling improves scarring and texture. For active acne, microneedling isn't appropriate as it can spread bacteria. Once acne is controlled, microneedling helps with residual scarring. Typical treatment plans include 3 to 4 treatments spaced 4 to 6 weeks apart. Microneedling is relatively affordable, $200 to $400 per treatment, compared to laser treatments. Extraction treatments remove comedones professionally. Hydrofacial uses suction and infusion to extract impurities without harsh manual extraction. Regular professional extractions by experienced estheticians safely remove comedones impossible to remove at home. Some dermatologists perform extractions as part of acne management, particularly when comedones are resistant to topical treatments. Intralesional steroid injections treat individual cystic acne lesions directly. A small amount of corticosteroid is injected into the cyst, causing rapid deflation and healing within days. This prevents cysts from persisting weeks or months and dramatically reduces scarring risk. Cost per injection is typically $25 to $75. This is not a treatment for widespread acne but rather for occasional large cysts. When considering professional treatments, assess treatment suitability for your specific concerns. Is your issue active acne, scarring, texture, or some combination? Different treatments address different concerns. Realistic expectations are essential. Even professional treatments require multiple sessions and gradual improvement over months. Budget considerations matter. Professional treatments can be expensive. Discuss your goals, budget, and expectations with your dermatologist. Combination professional approaches often yield best results. Monthly superficial chemical peels combined with quarterly fractional laser treatments, for example, address multiple aspects of acne and scarring simultaneously. Your dermatologist can recommend an appropriate combination for your specific situation. Guide 16: When to see a dermatologist, recognizing acne severity and treatment failure. Knowing when to seek professional dermatological help prevents prolonged acne suffering, psychological distress, and permanent scarring. Several clear indicators suggest you should see a dermatologist. Severe widespread acne covering large areas of your face and body warrants dermatological evaluation. Extensive acne suggests a need for systemic treatment beyond what topical treatments typically achieve. Dermatologists can prescribe oral medications, hormonal treatments, or isotretinoin, Accutane, for severe cases. Numerous cystic acne lesions, particularly if they're large, painful, and prone to scarring, require professional intervention. Cystic acne rarely responds adequately to topical treatments and often requires intralesional steroid injections, oral antibiotics, or other systemic treatments. Treatment failure after 8 to 12 weeks of consistent appropriate treatment suggests your acne requires professional intervention. If you've conscientiously followed a good skincare routine with proven treatments like benzoyl peroxide, salicylic acid, and retinoids for 8 to 12 weeks without significant improvement, your acne likely requires prescription treatments or systemic medications. Rapid acne onset or sudden severe acne worsening in adults may indicate hormonal imbalances, medication side effects, or other medical conditions. Professional evaluation can identify underlying causes and recommend appropriate treatment. Women experiencing sudden severe acne should be evaluated for PCOS or other hormonal disorders. Acne causing significant psychological distress, depression, anxiety, or social withdrawal warrants professional intervention regardless of acne's severity. Mental health impacts justify professional dermatological treatment. Acne with signs of infection, increasing warmth, swelling, pus drainage, fever, requires prompt medical attention. These signs may indicate infection beyond typical acne and require professional assessment and possibly antibiotics. Acne concentrated on your body, back, chest, shoulders, and resistant to typical acne treatments may indicate fungal acne or other skin conditions requiring professional diagnosis and treatment. Concerns about permanent scarring or hyperpigmentation justify professional consultation. Early professional intervention can prevent or minimize scarring through aggressive treatment or appropriate professional therapies. During a dermatology visit, be prepared to discuss your acne history, previous treatments tried and their results, family history of acne, recent lifestyle changes, menstrual history, if applicable, and medications or supplements you take. Bring photos of your acne at different stages if possible. Discuss your specific concerns, whether you're most worried about current acne, scarring, or overall timeline to clear skin. Your dermatologist can prescribe prescription-strength treatments unavailable over the counter. Prescription retinoids, tretinoin, adapalene, tazarotene, are more powerful than over-the-counter retinol. Prescription antibiotics, oral doxycycline, minocycline, or topical clindamycin, treat bacterial acne. Spironolactone manages hormonal acne in women. Isotretinoin, Accutane, is a last-resort powerful medication for severe acne resistant to other treatments. Your dermatologist can identify acne triggers specific to you and recommend appropriate prevention strategies. They can also recommend or perform professional treatments like chemical peels, laser therapy, or extraction that aren't accessible outside dermatology. Finding a good dermatologist matters. Ask for referrals from your primary care doctor, friends, or family. Check online reviews and credentials. During your first visit, assess whether the dermatologist listens to your concerns, explains treatments thoroughly, and seems genuinely interested in helping you. A good dermatologist-patient relationship improves treatment outcomes. Guide 17, Treating Rosacea, Seborrheic Dermatitis, and Other Acne-like Conditions. Several skin conditions mimic acne but require different treatments. Misdiagnosis leads to inappropriate treatment and worsening of the underlying condition. Understanding these conditions helps ensure proper diagnosis and effective treatment. Rosacea is a chronic inflammatory condition characterized by facial flushing, persistent redness, small blood vessels, and sometimes pustules. Unlike acne, rosacea typically doesn't involve comedones and occurs more commonly in adults over 30. Rosacea is triggered by heat, spicy foods, alcohol, stress, and certain skincare products. Treatment focuses on trigger avoidance and skin barrier repair rather than bacterial killing. Or alternating hairstyles reduces friction acne. Phone contact with your face transfers bacteria and causes friction acne on the jawline and cheek. Using earbuds or speakerphone when possible, cleaning your phone screen regularly, and taking breaks from phone use reduce this contact-related acne. For occupational friction acne, workers in certain industries, workplace modifications and protective equipment prevent acne. Ensuring clean, breathable protective equipment and maintaining good hygiene at work helps control occupational friction acne. Acne mechanica is often preventable through simple environmental modifications. Unlike acne requiring medications, friction acne responds to preventing the friction. This makes acne mechanica particularly frustrating when it occurs, since prevention is often simpler than treatment. Guide 54. Drug-induced acne and medication side effects. Certain medications trigger or worsen acne as a side effect. Recognizing drug-induced acne allows you to work with prescribers to modify medications or manage acne while necessary medications are continued. Corticosteroids commonly trigger acne or worsen existing acne. Systemic corticosteroids, oral, are more likely to cause acne than topical steroids, though topical steroids applied to face can also trigger acne. Patients on chronic systemic corticosteroids often experience significant acne requiring aggressive treatment. If corticosteroids are necessary, combining them with acne treatment is often required. Lithium, used for bipolar disorder treatment, causes acne in many patients. The mechanism involves effects on follicular epithelium and sebaceous gland function. Acne from lithium is sometimes severe. Working with your psychiatrist on whether alternative mood stabilizers are possible, or combining lithium with aggressive acne treatment, might be necessary. Anabolic steroids cause severe acne in nearly everyone using them. Anabolic steroid use for performance enhancement causes acne that often requires isotretinoin for management. The acne is typically severe, widespread, and on the trunk as well as face. Hormonal contraceptives can either improve or worsen acne depending on the specific formulation. Progestins with androgenic properties, like levonorgestrel or norgestrel, might worsen acne, while progestins with minimal androgenic activity, like norgestimate or drospirenone, often improve acne. If birth control is worsening acne, switching to a formulation with less androgenic progestin often helps. Anti-seizure medications sometimes worsen acne through various mechanisms. Working with your neurologist if seizure medications are worsening acne might identify alternatives or necessitate aggressive acne management. Vitamin B12 supplementation can paradoxically worsen acne in some individuals through unknown mechanisms. If you take B12 supplements and notice acne worsening, discontinuing B12 might help. Iodine-containing supplements or medications can trigger acne. High-dose iodine supplementation is associated with acne worsening. This is one reason avoiding excessive iodine supplementation unless specifically indicated is prudent. Phenytoin, anti-seizure medication, and other older anti-seizure drugs can trigger acne or gingival hyperplasia, gum overgrowth. If these medications are necessary, managing side effects is required. When drug-induced acne is suspected, first confirm with your prescribing healthcare provider that the medication is likely the culprit. Assess whether alternative medications without acne side effects exist. If alternatives don't exist, combine the medication with aggressive acne treatment. Don't discontinue necessary medications without medical guidance even if acne worsens. Guide 55. Nutritional deficiencies and acne, zinc, vitamin D, selenium, and beyond. Certain nutritional deficiencies correlate with worse acne. Understanding which deficiencies affect acne allows you to assess your nutritional status and supplement if needed. Zinc deficiency is well established as correlating with worse acne. Zinc supports immune function, wound healing, and inflammation regulation, all relevant to acne. People with zinc deficiency have notably worse acne. Supplementing adequate zinc, 30 mg daily, often improves acne significantly if deficiency exists. However, supplementing when not deficient provides minimal additional benefit. Identifying zinc deficiency involves blood testing. However, zinc blood levels don't always accurately reflect total body zinc stores, making interpretation complex. If you suspect zinc deficiency, discussing blood zinc testing with your healthcare provider is reasonable. Vitamin D deficiency correlates with worse acne and increased inflammation. Vitamin D supports immune function and has anti-inflammatory effects. Many people, particularly those in northern climates or those who avoid sun exposure, have vitamin D deficiency. Supplementing vitamin D at 1000 to 400 IU daily improves acne in some individuals, particularly those with low baseline levels. Testing vitamin D status can help identify deficiency. Selenium deficiency affects immune function and skin health. Adequate selenium, 55 to 200 micrograms daily, supports skin health. However, acne-specific benefits of selenium supplementation aren't definitively established. Iron deficiency, particularly in menstruating women, can affect overall skin health and healing. Severe iron deficiency anemia causes various health problems including poor wound healing and immune dysfunction. However, iron supplementation for non-deficient people doesn't improve acne. Vitamin A, retinol, deficiency causes follicular hyperkeratinization and immune dysfunction contributing to acne. However, toxicity from excess vitamin A is also problematic. Getting adequate vitamin A through diet, liver, sweet potato, leafy greens, is ideal. Supplementing vitamin A is only necessary if deficient. B vitamins, particularly B5, pantothenic acid, are promoted for acne at very high doses, 10 plus grams daily. However, evidence is weak and high-dose B5 causes diarrhea frequently. Normal B vitamin intake through diet or multivitamin supplementation supports general health without special acne benefits. Omega-3 fatty acid deficiency promotes systemic inflammation worsening acne. Getting adequate omega-3s, 1 to 2 grams EPA plus DHA daily from fish or supplements, supports skin health through inflammation reduction. Identifying nutritional deficiencies, blood testing can assess status for most nutrients. Dietary assessment helps identify if diet provides adequate nutrients, considering supplementation if deficiencies are identified. However, supplementing without deficiency rarely provides additional benefit. Getting nutrients through food when possible is preferable to supplementation. Guide 56, Occupational Acne Syndromes, Tar acne, Oil acne, and Chemical exposure. Workers in certain occupations experience acne specifically from occupational chemical exposures. Understanding occupational acne helps you implement prevention strategies and pursue appropriate treatment. Tar acne develops in workers exposed to coal tar, crude oil, and petroleum products. Mechanics, road workers, and petroleum industry workers are susceptible. Tar acne results from follicular occlusion and irritation from these substances. Appearance is often on exposed areas, hands, face, neck, forearms. Oil acne develops in workers exposed to mineral oils and cutting fluids in metalworking. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers, while others contain actives like retinol or acids. These work well for providing intensive treatment without time constraints. Apply as your final nighttime step and sleep with the mask on. Spot masks apply highly concentrated treatments to specific areas rather than your entire face. These are useful when some areas are more problematic than others. Apply to clean skin and leave on as directed. Important mask principles: never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily home routines yield better results than either approach alone. Professional treatments accelerate improvement and address concerns beyond what home treatments achieve. Frequency of professional facials depends on your skin concerns and treatment type. Most people benefit from monthly treatments initially, then maintenance every 4 to 8 weeks once acne clears. Discuss appropriate frequency with your esthetician or dermatologist based on your skin condition and treatment response. Professional facials can be expensive, but the results often justify the investment for moderate to severe acne or significant scarring. Many dermatology offices offer facials at reasonable costs compared to standalone aesthetic spas. Guide 14, Diet, Nutrition, and Lifestyle Changes for Clear Skin. While skincare products are essential for acne management, what you consume and how you live profoundly affects your skin. Understanding dietary and lifestyle factors allows you to address acne from internal and external angles simultaneously. High glycemic foods spike blood sugar rapidly. When blood sugar spikes, full treatments, typically 3 to 6, provide progressive improvement. Laser resurfacing works for all scar types but is most effective for shallow scars and ice pick scars. Dermal fillers inject material beneath scars to fill depressions temporarily. Different fillers last varying lengths. Some last 6 months, others 1 to 2 years. This approach works well for ice pick and boxcar scars but requires repeat treatments. Filler results are immediate, making this attractive for short-term improvement. Microneedling creates controlled microinjuries, stimulating collagen production and remodeling scarred tissue. Multiple sessions, typically 4 to 6, provide progressive scar improvement. Microneedling works for all scar types and is relatively affordable compared to laser treatments. Chemical peels can improve shallow scars through repeated treatments. TCA, trichloroacetic acid, peels at medium depth can improve scar appearance, though results are less dramatic than laser or microneedling. Treatment selection depends on scar type, depth, and individual factors. Dermatologists typically recommend combination approaches, perhaps subcision combined with microneedling, or laser resurfacing combined with fillers. Severe, extensive scarring might warrant multiple treatment types performed sequentially. Realistic expectations are essential. Most scars can be significantly improved but rarely completely eliminated. Even after multiple treatments, mild scarring typically remains. However, significant improvement is usually achievable with appropriate treatments. Guide 13: Face masks and professional facials for acne management. Face masks and professional facials supplement your daily skincare routine, providing concentrated treatments and professional expertise. Understanding various mask types and facial treatments helps you select appropriate options for your skin concerns. Clay masks absorb excess oil and impurities, making them ideal for oily, acne-prone skin. Green clay and kaolin clay are particularly effective. These masks draw out sebum, bacteria, and impurities from pores. Use clay masks 1 to 2 times weekly for 10 to 15 minutes on clean skin. Apply evenly, avoiding the eye area. As the mask dries, you'll feel slight tightening as oil is extracted. Rinse with lukewarm water and follow with moisturizer, as clay masks can be drying. Sheet masks infused with acne-fighting ingredients like salicylic acid, tea tree oil, or niacinamide provide targeted treatment and hydration simultaneously. Apply sheet masks to clean skin for 15 to 20 minutes, then remove and pat remaining serum into skin. Use 2 to 3 times weekly. Sheet masks are convenient, mess-free, and come in numerous formulations targeting specific concerns. Hydrating masks with hyaluronic acid, glycerin, or ceramides balance skin and prevent overdrying from acne treatments. These masks are essential if your acne treatment regimen is causing excessive dryness. Use hydrating masks 1 to 2 times weekly, particularly on days when you're using strong actives like retinoids or chemical exfoliants. Mud masks similar to clay masks draw impurities from pores while providing mineral content. Some formulations include additional active ingredients. Use similarly to clay masks, 1 to 2 times weekly for 10 to 15 minutes. Charcoal masks draw impurities from deep within pores. While popular, they can be overly drying. Use sparingly, perhaps monthly, if you have very oily skin. Avoid if your skin is dry or sensitive. Overnight masks are left on overnight and act as intensive treatments. Some are essentially very rich moisturizers. to clean skin and leave on as directed. Important mask principles. Never use multiple mask types on the same day. Choose one mask per skincare session. Always follow mask application with appropriate moisturizer, as masks can be drying. Start with masks once weekly, increasing frequency only as your skin demonstrates tolerance. Don't leave masks on longer than recommended. Longer application doesn't mean better results and risks overdrying. Masks are supplements to your core routine, not replacements for daily cleansing and treatment. Professional facials go beyond at-home masks, utilizing professional strength products, specialized equipment, and esthetician expertise. A typical acne-focused facial includes cleansing, exfoliation, extraction, treatment mask, and moisturizer application. The extraction component, professional removal of comedones, provides benefits impossible to achieve safely at home. Hydrofacial uses suction technology to extract impurities from pores without harsh manual extraction. A spiral tip applies suction while simultaneously infusing treatment serums. Hydrofacials provide immediate visible improvement, particularly for comedones. Most people see results after a single treatment, with cumulative benefits after 4 to 6 treatments performed monthly. Chemical peel facials use professional strength acids, glycolic acid, salicylic acid, or lactic acid, to exfoliate multiple skin layers. Superficial peels cause mild redness and slight flaking but require no downtime. Medium peels cause more significant exfoliation and require several days of recovery. Chemical peels improve acne, texture, and hyperpigmentation significantly. Monthly superficial peels or quarterly medium peels provide excellent results. Blue light therapy facials use specific light wavelengths to kill acne-causing bacteria. Blue light, around 415 nanometers wavelength, is particularly effective against Cutibacterium acnes. Treatments typically last 15 to 20 minutes. Most treatment plans include 6 to 8 sessions, sometimes combined with red light therapy for inflammation reduction. Blue light therapy is particularly valuable for those seeking non-chemical treatment or for bacterial acne resistant to other treatments. Microdermabrasion facials use fine crystals or a diamond tip to physically exfoliate skin. This removes dead skin cells, unclogs pores, and stimulates collagen production. Results are immediate visible skin smoothing. Regular microdermabrasion, monthly, maintains clear skin and improves texture. Oxygen facials infuse pressurized oxygen with serums deep into skin. While marketed aggressively, evidence for exceptional benefits is limited. However, many people report improved hydration and glow after oxygen facials. Dermaplane facials use a sterile blade to remove fine facial hair and dead skin cells. This provides exfoliation and hair removal simultaneously. Results are immediate, smooth, bright skin. However, dermaplane isn't appropriate for acne-prone or actively inflamed skin, as the blade can irritate lesions. Laser facials use laser technology for exfoliation, collagen stimulation, and targeted treatment of specific concerns. Fractional laser facials are gentler than full laser resurfacing and provide results with minimal downtime. Professional facials are most effective when combined with consistent home skincare. Monthly professional treatments combined with daily. Guide 1. Complete understanding of acne, pathophysiology, types, and root causes. Acne is one of the most prevalent skin conditions affecting approximately 85% of people aged 12 to 24, with significant numbers also experiencing adult acne. To effectively treat acne, you must first understand its underlying mechanisms and various manifestations. Acne develops through a complex process involving four primary factors: increased sebum production, follicular hyperkeratinization, colonization by Cutibacterium acnes bacteria, and inflammation. The sebaceous glands, which produce sebum or skin oil, become hyperactive primarily due to hormonal stimulation. During puberty, androgens like testosterone trigger increased sebum production. This oil production is essential for skin protection, but excess sebum creates an environment conducive to acne development. The sebaceous glands have androgen receptors, meaning individuals with heightened sensitivity to hormones or with hormonal imbalances experience excessive sebum production. Follicular hyperkeratinization refers to the abnormal shedding of skin cells lining the hair follicle. Normally, dead skin cells shed and exit through the hair follicle to the skin surface. In acne-prone individuals, these cells stick together and don't shed properly, creating a plug within the follicle. This plug, combined with sebum, forms an ideal environment for bacterial growth and acne formation. Cutibacterium acnes, previously known as Propionibacterium acnes, is a naturally occurring bacterium on human skin. However, in the oxygen-poor environment created by plugged follicles, this bacterium proliferates rapidly. These bacteria produce enzymes and toxins that trigger the immune system, causing inflammation and the visible acne lesions you see on your skin. Inflammation is the final component and arguably the most visible aspect of acne. When the immune system responds to bacterial presence and follicle rupture, it sends inflammatory cells to the area, causing redness, swelling, heat, and the formation of pustules or nodules. Understanding this process is crucial because different acne treatments target different components of this mechanism. There are numerous acne types, each requiring different treatment approaches. Non-inflammatory acne includes blackheads and whiteheads. Blackheads, or open comedones, form when a follicle is clogged with sebum and dead skin cells, but the pore remains open. The dark appearance results from oxidation of the sebum, not dirt. Whiteheads, or closed comedones, occur when the follicle is completely sealed, trapping sebum and dead cells beneath the skin surface, creating a small white or flesh-colored bump. Inflammatory acne is more noticeable and potentially scarring. Papules are small, firm, red bumps without a visible center, representing the body's inflammatory response. Pustules are similar to papules but contain a visible yellow or white center filled with pus. These are the classic pimples most people recognize. Nodules are larger, deeper, solid lesions that develop when inflammation extends deeper into the skin. They're typically painful and can last for weeks. Cystic acne represents the most severe form, where large, fluid-filled lesions develop deep within the skin. These are extremely painful and highly prone to causing permanent scarring. Several factors contribute to acne development beyond just hormones and bacteria. Genetics play a significant role. If your parents had severe acne, you're more likely to experience it too. Environmental factors matter considerably. Living in humid climates can exacerbate acne due to increased moisture promoting bacterial growth. Pollution and environmental toxins can clog pores and trigger inflammation. Stress hormones like cortisol increase sebum production and inflammation, explaining why acne often worsens during stressful periods. Diet influences acne more than previously thought. High glycemic foods rapidly spike blood sugar, causing insulin surges that trigger sebaceous gland stimulation and androgen production. Dairy products, particularly skim milk, contain hormones and proteins that may trigger acne in susceptible individuals. Omega-3 fatty acid deficiency promotes inflammation, while excessive omega-6 consumption without sufficient omega-3s creates an inflammatory imbalance. Certain medications, including corticosteroids and lithium, are known to trigger or worsen acne as a side effect. Recognizing your specific acne type and identifying contributing factors is the first step toward effective treatment. Some people have purely hormonal acne, while others struggle with bacterial acne, dietary triggers, or environmentally influenced breakouts. Understanding your personal acne profile allows you to select treatments targeting your specific problem rather than wasting time and money on ineffective solutions. Guide 2: Comprehensive Daily Cleansing and Preparation Routine for Acne-Prone Skin. The foundation of any successful acne treatment regimen is an appropriate cleansing routine. Many people underestimate the importance of proper cleansing, believing that any soap will suffice. However, for acne-prone skin, the cleansing process is far more nuanced and critical to success. Your cleansing routine will prepare your skin for treatment products and remove substances that promote acne formation. Begin by understanding that you should cleanse your face twice daily, once in the morning and once at night. Morning cleansing removes the oil, dead skin cells, and bacteria that accumulate overnight while you sleep. Your skin is active at night, producing more sebum and shedding dead cells, so morning cleansing is not optional. Evening cleansing is equally important, removing makeup, environmental pollutants, dirt, excess oil, and dead skin cells accumulated throughout the day. Many people neglect evening cleansing or do it hastily, significantly compromising their acne treatment results. Temperature matters more than most people realize. Always use lukewarm water, never hot water. Hot water strips away your skin's natural oils and disrupts the skin barrier, leading to increased irritation and compensatory sebum overproduction. Excessively hot water also causes blood vessel dilation, temporarily increasing inflammation and making acne appear worse. Conversely, cold water doesn't effectively remove oil and impurities, leaving your skin inadequately cleansed. Selecting an appropriate cleanser is crucial. For acne-prone skin, choose a gentle, pH-balanced cleanser specifically formulated for this skin type. The pH of your skin is approximately 4.5 to 5.5, slightly acidic. Using alkaline soaps disrupts this pH balance, damaging your acid mantle and increasing sensitivity and bacterial overgrowth. Look for cleansers labeled pH-balanced or for acne-prone skin. Many quality acne cleansers contain salicylic acid, a beta-hydroxy acid that penetrates into pores to dissolve sebum and dead skin cells. A concentration of 0.5% to 2% is appropriate for daily cleansing. Some people prefer cleansers with benzoyl peroxide, which kills acne-causing bacteria. A 2.5% benzoyl peroxide cleanser is effective without excessive drying when used in a cleansing format rather than as a leave-on treatment. Others prefer gentle, fragrance-free cleansers without active ingredients, particularly if their skin is sensitive or if they're using other strong acne treatments. Experiment to find what works best for your skin, understanding that what works for your friend may not work for you. The cleansing process itself requires attention to technique. Wet your face thoroughly with lukewarm water to open your pores slightly and soften your skin. Apply your cleanser using your fingertips or a soft washcloth. Using your hands is often preferable because you have better control and can feel whether you're applying too much pressure. Gently massage the cleanser into your skin using circular motions for approximately 30 to 45 seconds. This duration gives the cleanser time to dissolve oil and loosen impurities without overstripping your skin. Pay special attention to your T-zone, your forehead, nose, and chin, where sebum production is typically highest. However, don't neglect other areas, particularly your jawline and cheeks where hormonal acne often appears. Be especially gentle around your eyes and lips where skin is thinner and more sensitive. Never use a rough scrub or washcloth, as physical abrasion can irritate acne lesions, spread bacteria, and increase inflammation. After thoroughly massaging, rinse your face completely with lukewarm water. Ensure you remove all cleanser residue, as leftover cleanser can irritate your skin and interfere with the absorption of treatment products. Pat your face gently dry with a clean, soft towel. This is important. Never rub your face dry aggressively. Aggressive rubbing irritates inflamed acne, increases inflammation, and can spread bacteria to other areas of your face. Recurrent acne after previous isotretinoin course might be retreated with isotretinoin, though some dermatologists reserve retreatment for specific circumstances. The process of obtaining isotretinoin involves consultation with a dermatologist willing to prescribe it, understanding all requirements and side effects, baseline laboratory testing, and enrollment in iPledge. For women, establishing contraception plan is necessary. Once established on isotretinoin, compliance with monthly visits and laboratory tests is mandatory. Non-compliance results in treatment discontinuation. Cost is a consideration. Isotretinoin itself is relatively inexpensive. The original brand Accutane is expensive, but generic isotretinoin is affordable. However, the required monthly visits and laboratory tests add significant cost. Insurance typically covers isotretinoin for severe acne, but coverage varies. Discussing cost with your dermatologist before starting is important. Results from isotretinoin are remarkable. Most patients experience dramatic acne improvement within 1 to 2 months, with near-complete clearance by 3 to 4 months. The persistence of results years after treatment completion is what makes isotretinoin special. Most other treatments require ongoing use for results to persist. Post-isotretinoin skin care involves using gentle products, as skin is often more sensitive after treatment. Many patients can use minimal skin care after isotretinoin, though some benefit from occasional retinoid maintenance to prevent any acne recurrence. Most patients can essentially stop acne-focused skin care and use only basic skin care and sunscreen. Isotretinoin should not be your first treatment. Attempting appropriate topical treatments, salicylic acid, benzoyl peroxide, retinoids, and potentially oral antibiotics for several months should precede isotretinoin consideration. However, if you have severe acne causing scarring risk or significant distress, don't suffer for years without considering isotretinoin. Discuss it with your dermatologist if you have severe, resistant acne. Guide 22, Oral Antibiotics for Acne, Types, Mechanisms, Resistance, and Long-Term Management. Oral antibiotics have been acne treatment staples for decades, effectively controlling moderate to severe inflammatory acne. understanding antibiotic options, their effectiveness, the critical issue of antibiotic resistance, and appropriate usage patterns is essential for optimal acne treatment. Oral antibiotics treat acne through multiple mechanisms. First, they kill Cutibacterium acnes bacteria, reducing bacterial colonization in follicles. Second, at acne-treating doses, they have significant anti-inflammatory effects beyond their antibacterial properties. Third, they can reduce lipase production, an enzyme that increases sebum irritancy, decreasing acne inflammation. The combination of these effects makes antibiotics highly effective for inflammatory acne. Doxycycline is the most commonly prescribed oral antibiotic for acne. It's effective, relatively inexpensive, and generally well tolerated. Typical dosing is 100 mg once or twice daily. Doxycycline has additional anti-inflammatory effects beyond its antibacterial action, partly explaining its effectiveness for acne. However, doxycycline has notable drawbacks. It can cause photosensitivity, sun sensitivity, so strict sunscreen use is essential during treatment. It can cause esophageal irritation if not taken properly, requiring taking it upright with significant water and not lying down for 30 minutes afterward. Some women experience vaginal yeast infections due to disruption of normal bacterial flora. Birth control pill effectiveness can be reduced by doxycycline in some individuals, requiring backup contraception. Minocycline is an alternative tetracycline antibiotic with similar effectiveness to doxycycline. It's lipophilic, fat-soluble, allowing it to penetrate sebaceous glands well. Minocycline can cause blue discoloration of skin and mucous membranes with long-term use. While this is reversible upon discontinuation, it's an undesirable potential side effect. Minocycline also has slightly higher risks of drug-induced lupus and autoimmune hepatitis compared to doxycycline, though these are rare. Many dermatologists now prefer doxycycline over minocycline due to these considerations. Azithromycin is a macrolide antibiotic sometimes used for acne. It's taken at lower doses than typical infection-treating doses, 250 mg 3 times weekly. Azithromycin has strong anti-inflammatory effects. However, Cutibacterium acnes resistance to azithromycin is increasingly common, making it less reliable than tetracyclines. Azithromycin is often reserved for patients who cannot tolerate tetracyclines. Trimethoprim sulfamethoxazole, TMPSMX, is a combination antibiotic occasionally used for acne, particularly in patients who cannot tolerate tetracyclines. However, it's less effective than tetracyclines and has higher allergy rates, limiting its use. Combining retinoids with other acne treatments provides advanced results. After retinoid tolerance is established, typically 8 to 12 weeks, carefully introducing benzoyl peroxide on different days, perhaps retinoid at night, benzoyl peroxide in the morning or on different evenings, can enhance overall acne control. However, this requires careful management. Combining retinoids with strong treatments too early in the process causes excessive irritation. Wait until you're using retinoids nightly without significant irritation before attempting combination with benzoyl peroxide. Combining salicylic acid with retinoids requires similar caution. Both are exfoliating and somewhat irritating, so combining them immediately is unwise. After 8 to 12 weeks of stable retinoid use with good tolerance, you might use salicylic acid cleanser in the morning and retinoid at night. The salicylic acid provides daytime exfoliation and sebum control, while retinoid provides nighttime cellular turnover and anti-inflammatory benefits. Oral antibiotics plus retinoids represent an advanced combination for moderate inflammatory acne. The antibiotic controls bacterial inflammation while the retinoid addresses cellular turnover and sebaceous gland normalization. This combination is particularly effective for acne resistant to topical treatments alone. However, careful introduction is necessary. If possible, allow 4 to 8 weeks of antibiotic therapy before introducing retinoids, then start retinoids at low frequency and concentration. Hormonal treatments combined with topical treatments represent a synergistic approach for hormonal acne in women. Oral contraceptives or spironolactone address the hormonal root cause, while topical treatments manage surface acne manifestations. This combination often provides superior results to either approach alone. For example, a woman might be on spironolactone plus doxycycline plus benzoyl peroxide, addressing hormone regulation, bacterial factors, and inflammation simultaneously. Chemical peels combined with home treatments provide enhanced results. Monthly superficial chemical peels combined with daily topical acne treatments provide more dramatic results than either approach alone. The chemical peel removes surface impurities and promotes cellular turnover, while daily treatments maintain and enhance the peeling results. Vitamin C plus niacinamide represents a complementary antioxidant combination that doesn't directly treat acne but provides skin-supportive benefits. Both are non-irritating and well-tolerated together. Apply vitamin C in the morning for antioxidant protection, and niacinamide can be included in morning or evening moisturizers. These support overall skin health during active acne treatment. Important principles for combination therapy. Never introduce multiple new treatments simultaneously. If you want to combine treatments, introduce them sequentially. Establish tolerance to one treatment before adding another. After 1 to 2 weeks of consistent use, inflammatory acne should appear less red and swollen. After 4 weeks, you should see significant improvement in the number of inflammatory lesions. Full results typically appear after 6 to 8 weeks of consistent use. Long-term use of benzoyl peroxide is safe and very common. Many people successfully maintain clear skin for years using benzoyl peroxide as their primary acne treatment. However, some dermatologists recommend occasionally taking breaks from benzoyl peroxide, perhaps 1 week per month, to allow your skin's natural bacteria to repopulate normally. This isn't absolutely necessary, but some people find it helpful in maintaining overall skin health. One important consideration: never use benzoyl peroxide with vitamin C or niacinamide at the same time, as benzoyl peroxide can oxidize these ingredients, reducing their effectiveness. Apply these ingredients in the morning and benzoyl peroxide in the evening, or use them on different days. Guide 6: Retinoids, the Gold Standard Anti-Aging and Acne Treatment Comprehensive Guide. Retinoids represent the gold standard in skincare science, with decades of research supporting their effectiveness for acne, aging, and general skin health. Understanding retinoids' mechanism, types, concentrations, and proper use is essential for anyone serious about achieving clear, healthy skin. Retinoids are vitamin A derivatives that work through multiple powerful mechanisms. First, they increase cellular turnover, causing your skin to shed old cells and reveal fresh, new skin underneath. This prevents dead skin cell accumulation that leads to clogged pores and comedones. Second, they normalize sebaceous gland function, helping regulate sebum production. Third, they stimulate collagen production, improving skin elasticity and minimizing fine lines. Fourth, they have anti-inflammatory effects, reducing the redness and irritation of acne. Fifth, they prevent follicular hyperkeratinization, the abnormal cell shedding that contributes to acne. Sixth, they have antioxidant properties, protecting skin from free radical damage. The retinoid family includes various types at different strengths. Over-the-counter retinol is the gentlest form, requiring conversion by your skin's enzymes to the active retinaldehyde and then to retinoic acid. This multi-step conversion process makes retinol gentler but less immediately effective than prescription retinoids. Retinol, retinaldehyde, is slightly more powerful than retinol, requiring one fewer conversion step. Prescription retinoids include tretinoin, retin-A, adapalene, differin, and tazarotene, which are already in their active form and thus more powerful and faster acting than over-the-counter options. For someone new to retinoids, starting with over-the-counter retinol at a low concentration, 0.25 to 0.3%, is typically appropriate. This allows your skin to build tolerance gradually. After several months of consistent retinol use, you might consider asking your dermatologist about prescription retinoids for enhanced results. Retinoids are only used at night because they increase sun sensitivity substantially. UV exposure dramatically increases the risk of photosensitivity reactions and post-inflammatory hyperpigmentation. Morning retinoid use would leave your skin vulnerable to severe sun damage throughout the day. When starting retinoids, begin with a very conservative approach. Use a low-concentration retinol product just 2 to 3 times per week initially. Apply it to completely dry skin, as retinoids irritate damp skin significantly. Wait 20 minutes after cleansing before applying retinoid to ensure your skin is completely dry. Use a pea-sized amount for your entire face. Retinoids are potent and a little goes a long way. During the first 4 to 12 weeks of retinoid use, expect a retinization phase characterized by redness, peeling, flaking, and sometimes temporary worsening of acne. This is normal and doesn't indicate that retinoids aren't appropriate for you. This phase typically lasts 2 to 8 weeks and gradually resolves as your skin adapts. Many people who discontinue retinoids during this phase miss out on their incredible long-term benefits simply because they couldn't tolerate the short-term adjustment period. Managing retinization involves strategic moisturizing. Use your retinoid, then wait about 20 minutes, then apply a hydrating moisturizer over top. Some people layer their moisturizer directly on top of wet retinoid serum, which dilutes the retinoid slightly and reduces irritation. This is called the sandwich method. This method is appropriate when dealing with significant irritation. As your skin adapts, you can gradually stop using the sandwich method. Never combine retinoids with other strong actives initially. Using retinoids with benzoyl peroxide, salicylic acid, or chemical exfoliants on the same evening will cause severe irritation. Once your skin is adapted to retinoids alone, typically after 8 to 12 weeks, you might carefully introduce another active on different evenings. Eventually, some people successfully combine retinoids with other treatments, but build up to this gradually. Vitamin C and other antioxidants can be used with retinoids. Apply vitamin C in the morning and retinoids at night, or apply them on different days. Niacinamide can be used with retinoids in most cases, but some people find them together irritating initially. SPF 30+ broad-spectrum sunscreen is absolutely mandatory every single day when using retinoids, even if you don't plan to go outside. Window glass blocks most UVB rays but not UVA rays, meaning significant sun damage can occur even indoors. Reapply sunscreen every 2 hours if you'll be in the sun. Wear protective clothing, hats, and sunglasses when possible. The combination of retinoid use and sun exposure can cause severe reactions and permanent skin damage. As your skin adapts to retinoids over 8 to 12 weeks, gradually increase usage frequency. After tolerating 2 to 3 times weekly for 4 weeks, increase to 3 to 4 times weekly. After another 4 weeks, increase to 5 to 6 times weekly. Eventually, many people use retinoids nightly. This gradual progression minimizes irritation and maximizes adaptation. If you experience severe irritation, excessive peeling, or significant discomfort at any point, reduce back to a lower frequency. There's no rush. Building retinoid tolerance over several months is perfectly acceptable. Consistency matters far more than speed. Someone using retinol 2 to 3 times weekly for years will see better results than someone who uses it daily for 2 months then stops. Results from retinoid use appear gradually but are remarkable. After 4 weeks, you might notice smoother texture and reduced comedones. After 8 weeks, reduced acne and early signs of improved skin tone. After 12 weeks, significant acne improvement, smoother texture, and visibly improved skin. After 6 months, improved fine lines, more even skin tone, and dramatically clearer skin. After 1 to 2 years, comprehensive skin improvement including acne prevention, minimal fine lines, even skin tone, and visibly healthier, more resilient skin. Prescription retinoids like tretinoin work faster than over-the-counter retinol. Starting tretinoin at 0.025% and increasing gradually can show acne improvement within 6 to 8 weeks rather than 12 weeks. However, prescription retinoids cause more significant initial irritation, making the starting process more challenging. Many dermatologists recommend beginning with over-the-counter retinol to build tolerance, then switching to prescription retinoids if additional strength is needed. Retinoids are teratogenic, meaning they can cause birth defects if used during pregnancy. Women of childbearing age should use reliable contraception when using retinoids and should discontinue use if planning pregnancy or if pregnancy is suspected. Men can use retinoids without this concern. Common mistakes with retinoids include starting with too high a concentration, using them too frequently initially, applying to damp skin, using them with too many other actives, or discontinuing them during the retinization phase. Starting right requires patience and conservative progression. The reward for proper retinoid use is clear, youthful, healthy skin that continues improving even after years of use. Guide 7. Hormonal acne in women, causes, recognition, and comprehensive medical management. Hormonal acne is a distinct type of acne that affects many women and some men, following predictable patterns related to hormonal fluctuations. Understanding hormonal acne's unique characteristics and treatment approaches is essential for women struggling with acne that doesn't respond adequately to standard topical treatments. Hormonal acne typically appears as deep, cystic lesions, often concentrated around the jawline, chin, and lower face. These lesions are painful, tender to the touch, and located deep within the skin rather than on the surface. They're often described as having no head, meaning they don't develop the white or yellow center that surface pimples have. They can persist for weeks, comedogenic and occlusive, clogging pores and promoting acne. Oil acne is often quite severe if exposure is chronic. Chloracne results from exposure to chlorinated hydrocarbons in chemical manufacturing. This is rare, but when occurs, is severe. Chloracne is characterized by cystic acne and systemic symptoms from toxic chemical exposure. Prevention strategies for occupational acne include wearing protective equipment, gloves, long sleeves, face protection when possible, washing thoroughly at end of work shifts to remove chemicals from skin, changing out of contaminated clothing immediately, using workplace-provided safety measures and equipment, discussing with employers if exposures can be reduced or if different equipment can minimize exposure. Treating occupational acne while reducing exposures through workplace modifications is important. Standard acne treatments combined with occupational hygiene improvements provide best results. Workplace legal considerations matter if acne results from unsafe occupational exposures. In some jurisdictions, occupational skin diseases are covered under workers' compensation. Documenting occupational exposure history and acne onset can establish occupational causation. Guide 57, Asian Skin, Rosacea, and Acne in East Asian Populations. East Asian skin has specific characteristics affecting acne presentation and treatment response. Understanding these characteristics improves acne management in East Asian populations. East Asian skin often has different lipid composition and barrier characteristics compared to other populations. Some evidence suggests East Asian skin has higher ceramide content but different lipid organization, affecting both barrier function and acne development. Rosacea is increasingly recognized in East Asian populations, though historically was underdiagnosed. East Asian rosacea often presents as acne-like lesions, acne rosacea, potentially confused with bacterial acne. Recognizing rosacea as distinct from acne ensures appropriate treatment selection. Sebaceous gland characteristics may differ slightly across ethnic backgrounds, though individual variation exceeds group variation. Treatment intensity might require individualization based on individual skin characteristics rather than ethnic background. Post-inflammatory hyperpigmentation is very common in East Asian skin and requires aggressive prevention and treatment. Sun protection is particularly important. PIH treatments, vitamin C, azelaic acid, hydroquinone, are particularly relevant. Barrier function support might be particularly important for East Asian skin in certain climates. Adapting treatment intensity and moisturizing based on individual response rather than population averages is most accurate approach. Guide 58, Acne in LGBTQ+ populations, Hormone Therapy and Transition-Related Acne. Transgender and non-binary individuals receiving hormone therapy often experience acne changes related to hormonal transition. Understanding these changes helps manage acne during transition. Testosterone-based hormone therapy, for transmasculine individuals, typically worsens acne initially due to increased androgens. Acne often develops or significantly worsens during the first 1 to 2 years of testosterone therapy. This is particularly challenging for individuals already prone to acne. Aggressive acne prevention and treatment during testosterone initiation is important. Some individuals benefit from starting acne treatment prophylactically before or as testosterone therapy begins. Estrogen-based hormone therapy, for trans feminine individuals, typically improves acne over time as androgens are suppressed. Many trans feminine individuals experience significant acne improvement within several months to a year of estrogen therapy. This improvement can be dramatic and psychologically significant. Spironolactone, commonly used alongside estrogen therapy for anti-androgen effects, has acne beneficial effects. The combination of spironolactone plus estrogen provides maximal acne improvement in trans feminine individuals. Timeline for hormone therapy acne effects is important to understand. Acne worsening from testosterone therapy might persist 1 to 2 years before stabilizing or improving. Setting realistic expectations prevents discouragement during this period. Psychological impact of acne during transition deserves acknowledgement. Acne during transition, when someone is often already managing significant life changes and body image adjustments, can cause additional distress. Aggressive acne management acknowledges this psychological weight. Working with dermatologists and endocrinologists familiar with transgender health improves care. Some clinicians are specifically experienced in managing acne in hormone therapy contexts. Guide 59, Acne Prevention in Acne-Prone Individuals, True Primary Prevention. True primary prevention prevents acne from developing in susceptible individuals before breakouts occur. While this doesn't apply to those already experiencing acne, understanding prevention helps younger individuals or those with family history prevent severe acne. Risk factors for developing acne include family history, strong genetic component, male sex, higher baseline androgens, and adolescent/young adult age. Individuals with all three risk factors have highest acne development risk. Primary prevention strategies include skincare routines starting in early adolescence, gentle cleansing, sun protection, use of non-comedogenic products, education about acne triggers and prevention, stress management techniques learned early, healthy diet emphasizing whole foods, adequate sleep, limiting skin trauma, not picking at skin, avoiding aggressive products. Non-comedogenic product selection starting early prevents product-induced acne. Teaching teenagers to evaluate skincare products and cosmetics prevents years of unnecessary acne from products. Early intervention at first signs of acne prevents progression to severe acne. Starting mild treatments, salicylic acid cleanser, at the very first breakout often prevents acne from worsening. This early treatment is simpler than treating established. Tap water or filtered tap water is typically adequate. Unless you have specific water quality concerns, tap water is fine. Some people promote alkaline water for acne, claiming it reduces inflammation. However, your stomach acid immediately neutralizes any pH changes from drinking alkaline water, so drinking alkaline water doesn't meaningfully change your body's pH or skin conditions. Alkaline water claims are largely marketing. Herbal teas and other beverages contribute to hydration alongside water. Coffee and other caffeinated beverages have mild diuretic effects but still contribute to daily hydration. However, excessive caffeine consumption can worsen acne through stress and inflammation, so while counting toward hydration, caffeinated beverages shouldn't dominate your fluid intake. Hydration from food contributes to overall hydration. Fruits and vegetables contain significant water. Eating water-rich foods like watermelon, cucumber, lettuce, and citrus fruits contributes to hydration alongside drinking water. Relationship between hydration and acne typically takes 2 to 4 weeks to manifest. Improving hydration from dehydrated state to properly hydrated state might improve acne noticeably. However, increasing hydration beyond adequate amounts typically doesn't further improve acne. The practical approach: drink enough water to maintain adequate hydration, pale yellow urine, no thirst, distribute intake throughout the day, use lukewarm water for cleansing, and if you have hard or highly chlorinated water concerns, consider filtering. Hydration is one component of comprehensive acne management but not a standalone cure. Guide 36, Gut Health, Microbiome, and Emerging Research on Gut-Skin Axis. Emerging research increasingly implicates gut health and microbiota composition in acne development. Understanding gut-skin axis mechanisms and implementing strategies to support gut health offers another angle for acne management. The gut microbiome, the trillions of bacteria colonizing your digestive tract, influences systemic health including skin health. A healthy microbiome supports immune function, intestinal barrier integrity, nutrient absorption, and inflammation regulation. Microbiome dysbiosis, imbalanced bacterial composition, contributes to systemic inflammation, impaired immune function, and intestinal permeability, leaky gut, all of which correlate with worse acne. Several mechanisms link gut dysbiosis to acne. First, dysbiosis allows pathogenic bacteria to proliferate, producing lipopolysaccharides that trigger systemic inflammation. This systemic inflammation worsens acne. Second, dysbiosis compromises intestinal barrier integrity, allowing bacterial lipopolysaccharides and undigested proteins to enter circulation, further triggering inflammation and activating immune responses. Third, dysbiosis impairs production of short-chain fatty acids, butyrate, that support intestinal and immune health. Fourth, dysbiosis impairs estrogen metabolism in the gut, potentially contributing to hormonal acne in women. Several dietary factors contribute to dysbiosis. Excess sugar promotes pathogenic bacteria growth. Processed foods low in fiber and high in additives promote dysbiosis. Insufficient fiber intake results in inadequate short-chain fatty acid production. Excessive omega-6 polyunsaturated fat relative to omega-3 PUFA promotes inflammatory bacteria. Chronic stress, sleep deprivation, and certain medications, particularly antibiotics, also contribute to dysbiosis. Supporting gut health involves dietary modifications. Increasing fiber intake through whole grains, vegetables, legumes, and fruits promotes beneficial bacteria that produce short-chain fatty acids. Increasing omega-3 fatty acids relative to omega-6, eating more fish, walnuts, seeds, reducing processed food, supports beneficial bacteria. Consuming prebiotic foods, foods that feed beneficial bacteria, like asparagus, onions, garlic, and resistant starch supports beneficial bacteria growth. Fermented foods containing live bacteria provide probiotics supporting gut health. Yogurt, kimchi, sauerkraut, miso, tempeh, and kombucha all contain beneficial bacteria. Regular consumption of fermented foods supports diverse microbiota. However, benefits are modest compared to overall diet quality and should supplement rather than replace dietary improvements. Probiotic supplements provide concentrated bacteria claimed to support microbiota. However, evidence for probiotic efficacy is mixed and varying. Some people benefit noticeably from specific probiotic strains, while others see no benefit. If interested in probiotics, choosing high-quality products with documented effective strains, like Lactobacillus and Bifidobacterium species, and consulting your healthcare provider is reasonable. Probiotics for acne-specific benefit remain researched, not definitively proven. Avoiding unnecessary antibiotics protects microbiota. When antibiotics are necessary for infection, taking them is appropriate. However, demanding antibiotics for viral infections, which antibiotics don't treat, harms your microbiota unnecessarily. Using antibiotics only when truly needed protects long-term microbiota health. Managing stress supports microbiota health. Stress promotes dysbiosis through multiple mechanisms. Implementing stress management supports both gut and skin health through this mechanism. Adequate sleep supports microbiota health and is one of the highest impact microbiota interventions available. Most microbiota disruption occurs with sleep deprivation. Prioritizing 7 to 9 hours nightly supports microbiota health. Exercise supports beneficial microbiota diversity. Regular exercise promotes beneficial bacteria growth independently of diet. This is one of the many benefits of consistent exercise. Alcohol, particularly excessive consumption, harms microbiota. While occasional moderate alcohol consumption probably has minimal microbiota effects, chronic excess consumption disrupts microbiota significantly. Smoking harms microbiota, contributing another mechanism through which smoking worsens acne. Implications for acne management. While microbiota science is still emerging, supporting gut health through diet, fiber, whole foods, limited sugar, omega-3 support, probiotics potentially, though evidence is mixed, stress management, sleep, and exercise likely support skin health through multiple mechanisms including microbiota effects. These interventions support overall health beyond just acne, making them worthwhile even though direct acne benefit is still being researched. Guide 37, Hormonal Testing, Evaluation, and When to Pursue Endocrine Assessment for Acne. For women with hormonal acne, pursuing endocrine evaluation can identify underlying hormonal imbalances enabling targeted treatment. Understanding when hormonal testing is appropriate, which tests are relevant, and how to interpret results guides effective management. Hormonal acne patterns suggest hormonal involvement warranting evaluation. Acne appearing primarily on the jawline and chin, concentrated in the lower face, often indicates hormonal acne. Acne worsening cyclically around menstrual periods strongly suggests hormonal involvement. Adult acne onset, particularly after the teenage years, is often hormonal. Some experimentation, patience, and willingness to adjust based on results. Most acne responds to consistent, appropriate treatment. Your clear skin is achievable with the right approach for you specifically. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties leads to clear, healthy skin. Your acne journey is unique, but clear skin is absolutely achievable. #20 Expert Level Skin Care and Acne Treatment Guides, Part 3. Each guide, 10 to 15 minutes reading time. Guide 31, Acne Scar Treatments, Comprehensive Guide to All Scar Types and Advanced Therapy Options. Acne scars represent permanent reminders of severe acne, but modern dermatology offers numerous treatment options that can significantly improve scarring. Understanding different scar types, appropriate treatments, realistic outcomes, and combination approaches enables you to effectively address post-acne scarring. Acne scars exist in 3 primary morphologies, each requiring different treatment approaches. Ice pick scars are deep, narrow indentations resembling puncture wounds from an ice pick. These scars have sharp edges and typically measure 1 to 4 mm in diameter but penetrate deeply into the dermis. Ice pick scars are difficult to treat because their narrow base makes many standard treatments ineffective. Boxcar scars are wider depressions with relatively flat bottoms and sharp, vertical edges. These scars typically measure 4 to 6 mm or larger in diameter. Boxcar scars appear similar to chickenpox scars. Rolling scars are shallow depressions with sloping, rounded edges creating a wave-like appearance across the skin. Rolling scars often appear worse when skin is stretched due to their tethered nature. Understanding scar depth and type guides treatment selection. Shallow scars are often more responsive to surface treatments, while deep scars require deeper penetrating treatments. Mixed scar types within the same individual require combination approaches. Prevention remains the gold standard scar treatment. Avoiding picking, squeezing, or extracting acne prevents scarring. Treating acne aggressively to minimize deep inflammation prevents scarring. For anyone prone to severe acne, considering isotretinoin to prevent scarring is appropriate if acne is severe enough to cause scarring risk. For existing scars, numerous treatments provide varying degrees of improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural collagen loss that topical products cannot reverse. However, treating associated hyperpigmentation with topical treatments makes scars less noticeable. Subcision is a minor surgical procedure particularly effective for rolling and tethered scars. A needle or small scalpel is inserted under the scar, severing fibrous tissue anchoring the scar to deeper structures. This allows the scar to elevate as new collagen forms underneath. Subcision often requires multiple treatments performed weeks apart. Results develop over months as new collagen remodels. Subcision combined with other treatments, fillers, microneedling, often provides better results than subcision alone. Microneedling creates controlled microinjuries triggering collagen production and remodeling. The skin's healing response generates new collagen, improving scar appearance. Multiple treatments, typically 3 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Microneedling works for all scar types but is particularly effective for rolling and moderate boxcar scars. Post-treatment appearance includes temporary redness and microcrusting. Recovery takes 3 to 5 days for most people. Microneedling is relatively affordable compared to laser treatments and is increasingly popular for scar treatment. Radiofrequency microneedling combines microneedling with radiofrequency energy for enhanced collagen stimulation. This provides better results than standard microneedling but with more significant post-treatment appearance changes and potential side effects. Laser resurfacing removes thin layers of skin, smoothing scars and promoting collagen remodeling. Fractional laser resurfacing treats portions of skin, leaving untreated bridges for faster healing and less downtime than full resurfacing. CO2 fractional lasers are highly effective for acne scars. Multiple treatments, typically 4 to 6 sessions spaced 4 to 6 weeks apart, provide progressive improvement. Post-treatment appearance includes significant redness lasting several weeks and potential for whitening, hypopigmentation. Cost is substantial, $500 to $1,500 per treatment, but results are often dramatic. Erbium YAG fractional lasers are slightly less aggressive than CO2 lasers, with somewhat less downtime and slightly less dramatic results. For those seeking good results with less recovery time, Erbium YAG is a reasonable option. Chemical peels remove skin layers through acid application. Superficial peels with glycolic or salicylic acid remove only the superficial layer and provide minimal scar improvement. Medium-depth peels with TCA, trichloroacetic acid, penetrate deeper, removing epidermis and superficial dermis, providing better scar improvement. Medium peels require 5 to 7 days of peeling and recovery. Deep peels with phenol or high-concentration TCA penetrate most deeply but require significant recovery time and carry higher complication risks. Deep peels are rarely used for acne scars specifically, being reserved for severe aging or other conditions. Dermal fillers inject material beneath scars to elevate depressed scars temporarily. Different fillers last different durations. Hyaluronic acid fillers typically last 6 to 12 months, while longer-lasting fillers, calcium hydroxylapatite, polyl-lactic acid, last 12 to 24 months. Filler results are immediate, making this attractive for short-term improvement. However, repeated treatments are necessary to maintain results. Fillers work particularly well for ice pick and boxcar scars. Platelet-rich plasma, PRP, therapy uses concentrated growth factors from your own blood to stimulate collagen production and healing. PRP is injected into scarred areas, promoting new collagen formation. Multiple treatments are typically needed. While PRP is popular, evidence for its efficacy in acne scar treatment is mixed, and it's more commonly used as a supplement to other treatments rather than as monotherapy. Combination approaches yield best results for acne scarring. A typical combination might include subcision for tethered scars, followed by microneedling for collagen stimulation, combined with fractional laser for surface smoothing and additional collagen remodeling. This multimodal approach addresses different aspects of scarring simultaneously. Treatment planning requires professional expertise. Severe, extensive scarring warrants referral to specialized dermatologists experienced in scar revision. Your dermatologist can assess your specific scars and recommend appropriate treatments. Realistic expectations are essential. Most scars improve significantly, 50 to 75%, but are rarely completely eliminated. Severe, deep scarring might only achieve 30 to 40% improvement even with aggressive treatment. However, significant improvement is usually achievable and worthwhile. Timeline for scar improvement is measured in months and years, not weeks. After a laser treatment providing immediate dramatic improvement, additional improvement occurs over 3 to 6 months as collagen remodels. Multiple sequential treatments provide cumulative improvement over 6 to 12 months or longer. Cost is a consideration. Professional scar treatments are expensive, laser treatments $500 to $1,500 per session, multiple sessions required. Microneedling is more affordable at $200 to $400 per session. Fillers vary based on amount needed. Insurance typically doesn't cover cosmetic scar treatment. Discussing cost with your dermatologist and potentially planning treatment over time is reasonable. Home care between professional treatments supports improvement. Proper sun protection prevents hyperpigmentation that makes scars more noticeable. Hydration and appropriate skincare support skin healing. Some evidence suggests that certain topical ingredients like retinoids and vitamin C might provide modest scar improvement through collagen support, though these effects are minor compared to professional treatments. Scar appearance often improves naturally over years. Post-inflammatory changes gradually fade. Scars that seem severe initially might improve significantly over 12 to 24 months even without treatment, though active treatment accelerates improvement. Guide 32. Environmental and occupational factors influencing acne. Acne development isn't purely internal. Environmental and occupational factors significantly contribute to breakouts. Understanding these external factors allows you to modify your environment and workplace practices to support insulin surges, triggering increased sebaceous gland activity and androgen production, both of which worsen acne. Foods with high glycemic index include white bread, white rice, sugary beverages, refined cereals, and most processed snacks. Replace these with low glycemic alternatives: whole grain bread, brown rice, vegetables, legumes, and nuts. This dietary shift reduces blood sugar volatility and decreases acne-triggering hormonal responses. Dairy products, particularly milk, contain hormones and bioactive peptides that may trigger acne in susceptible individuals. Multiple studies demonstrate correlation between milk consumption and acne severity. The effect appears strongest with skim milk, likely because fat-soluble hormones are removed during processing, leaving bioactive peptides. If you consume significant dairy and struggle with acne, try reducing or eliminating dairy for 4 to 6 weeks to assess impact. Many people notice significant acne improvement after reducing dairy. If dairy doesn't appear to worsen your acne, you don't need to eliminate it. Omega-3 fatty acids reduce systemic and skin inflammation. Foods rich in omega-3s include fatty fish, salmon, mackerel, sardines, walnuts, ground flax seeds, and chia seeds. Eat omega-3 rich foods 2 to 3 times weekly or consider supplementation if dietary intake is insufficient. Studies show that increasing omega-3 intake improves acne, likely through inflammation reduction. Antioxidant-rich foods protect skin from free radical damage and reduce inflammation. Berries, blueberries, strawberries, raspberries, dark leafy greens, spinach, kale, colorful vegetables, carrots, bell peppers, tomatoes, and dark chocolate all contain powerful antioxidants. Eating colorful foods daily provides antioxidant support. Zinc supports immune function and skin healing. Foods rich in zinc include oysters, beef, pumpkin seeds, and chickpeas. Some evidence suggests zinc supplementation improves acne, particularly in zinc-deficient individuals. Typical supplementation is 25 to 30 milligrams daily. Don't exceed this without medical guidance, as excess zinc causes nausea and copper deficiency. Vitamin D plays roles in immune function and skin health. Sunlight exposure stimulates vitamin D production, but many people don't get adequate sun exposure. Vitamin D-rich foods include fatty fish, egg yolks, and fortified milk. Some people benefit from vitamin D supplementation, particularly during winter or in northern climates. Typical supplementation is 1,000 to 2,000 IU daily. Consult your doctor about appropriate dosing. Hydration deserves emphasis. Drinking adequate water, about 8 to 10 glasses daily, more with exercise, maintains skin hydration from within, supports detoxification, and promotes overall health. Proper hydration improves skin clarity and reduces compensatory sebum overproduction from dehydration. Limiting sugar and refined carbohydrates is perhaps the single most impactful dietary change for acne. Sugar causes inflammation throughout your body, worsens acne, and accelerates aging. Reducing sugar by replacing sugary beverages with water, limiting desserts, and avoiding processed foods with hidden sugar improves acne significantly. Most people notice improvement within 2 to 4 weeks of reducing sugar. Stress is a major acne trigger. Chronic stress increases cortisol production, which increases inflammation and androgen activity. Stress also triggers immune dysfunction, promoting bacterial overgrowth. Implementing stress reduction techniques is therefore essential. Meditation, yoga, deep breathing exercises, regular exercise, and time in nature all reduce stress and cortisol levels. Exercise provides multiple acne benefits. Regular aerobic exercise, 30 minutes, 5 days weekly, reduces stress, improves circulation, regulates hormones, and promotes overall health. However, exercise-related acne can occur from sweat and friction. Shower immediately after exercising, change into clean clothes, and avoid touching your face during exercise. Despite temporary exercise-induced acne risk, the overall benefits of regular exercise substantially outweigh risks. Sleep profoundly affects skin health. During sleep, your body releases growth hormone and reduces cortisol, supporting skin repair and reducing inflammation. Poor sleep increases cortisol, promotes inflammation, disrupts hormonal balance, and worsens acne. Consistently getting 7 to 9 hours of quality sleep significantly improves acne. Implement good sleep hygiene, maintain consistent sleep schedules, avoid screens an hour before bed, keep your bedroom cool and dark, and limit caffeine in the afternoon. Alcohol consumption worsens acne through multiple mechanisms. Alcohol increases inflammation, disrupts gut health, which influences skin, and dehydrates skin. If you drink alcohol, do so moderately and ensure adequate hydration. Heavy alcohol consumption noticeably worsens acne in most people. Smoking impairs skin healing, increases inflammation, and worsens acne. Smokers typically have worse acne than non-smokers. Quitting smoking improves acne and overall health dramatically. Gut health increasingly appears important for skin health. Poor gut microbiota diversity, gut inflammation, and increased intestinal permeability, leaky gut, correlate with acne. Eating fermented foods, yogurt, kimchi, sauerkraut, fiber-rich foods, vegetables, whole grains, legumes, and possibly taking probiotic supplements supports healthy gut microbiota. While gut acne connections are still being researched, the evidence suggests supporting gut health helps skin. Hormonal regulation through lifestyle is important, particularly for women with hormonal acne. Regular exercise, stress reduction, adequate sleep, and healthy diet all support hormonal balance. For women with PCOS or obvious hormonal acne, these lifestyle factors may reduce symptoms enough to minimize or eliminate the need for systemic medications like spironolactone or oral contraceptives. Important perspective: diet and lifestyle changes typically take 4 to 8 weeks to demonstrate skin effects. Don't expect immediate results. However, after 8 to 12 weeks of consistent dietary and lifestyle improvements, most people notice significant acne improvement. These changes provide benefits beyond acne: improved energy, better sleep, improved digestion, and overall better health. Guide 15. Professional dermatological treatments, chemical peels, laser therapy, and advanced technologies. Professional dermatological treatments provide powerful acne management beyond what home skincare achieves. Understanding various professional treatments, their mechanisms, appropriate candidates, and realistic expectations helps you make informed decisions about whether professional treatment is right for you. Chemical peels use acids to remove skin layers, treating acne, scarring, and texture issues. Superficial peels penetrate only the outermost skin layer and are the mildest type. These use low-concentration acids, 15 to 30% salicylic acid or glycolic acid, and require minimal recovery. Apply sunscreen after benzoyl peroxide and wait a few minutes before reapplying other products. Generally, sunscreen should be your final skincare step before makeup. If you develop a sunburn despite sunscreen use, cool compresses, hydration, and soothing products like aloe vera help. Avoid further sun exposure until healed. Severe sunburns are dangerous and should be treated seriously. However, if you're using appropriate sunscreen correctly and minimizing peak sun exposure, severe sunburns should be rare. Guide 12. Treating post-inflammatory hyperpigmentation and acne scarring. After acne heals, two primary complications can persist: post-inflammatory hyperpigmentation, dark marks, and physical scarring. Understanding these conditions and the various treatment approaches available is essential for achieving truly clear skin, not just clear of active acne but also free from acne's lasting marks. Post-inflammatory hyperpigmentation, PIH, appears as flat, dark patches or spots where acne was previously present. These marks result from inflammation triggering excess melanin production in healing skin. PIH is particularly common in individuals with darker skin tones and in areas that received more inflammation or trauma. Unlike active acne, PIH doesn't involve bacteria or require acne-specific treatments. It requires treatments targeting melanin and pigmentation. Understanding PIH timeline is important for realistic expectations. Most PIH gradually fades naturally over 6 to 12 months with consistent sun protection, even without treatment. However, this timeline can feel unacceptably long, motivating people to pursue active treatments. The good news is that numerous treatments significantly accelerate PIH fading. Sunscreen is the foundational PIH treatment. UV exposure directly darkens hyperpigmentation, extending the timeline for natural fading. Using SPF 30+ daily and avoiding sun exposure accelerates PIH resolution dramatically. Some PIH that might take 12 months to fade with poor sun protection might fade within 3 to 4 months with strict sun protection. Vitamin C serums brighten hyperpigmentation and even skin tone. L-ascorbic acid at 15 to 20% concentration is most effective, though magnesium ascorbyl phosphate and other stabilized forms also work. Apply vitamin C serum daily in the morning before sunscreen. Results typically appear after 4 to 8 weeks of consistent use. Vitamin C also provides antioxidant protection and stimulates collagen production as a bonus benefit. Niacinamide reduces post-inflammatory redness and even skin tone. At 4 to 5% concentration in moisturizers or serums, applied daily, Niacinamide shows improvements in PIH within 4 to 8 weeks. Niacinamide is gentle, suitable for even very sensitive skin, and works well in combination with other treatments. Azelaic acid is particularly effective for PIH. At 15 to 20% concentration, applied twice daily, azelaic acid reduces melanin production and even skin tone. Prescription azelaic acid, Azalex, Phenacea, is more potent than over-the-counter versions. Many dermatologists recommend azelaic acid specifically for PIH management. Results typically appear within 4 to 8 weeks. Kojic acid inhibits melanin production. Available in serums and creams at 1 to 2% concentration, applied daily, kojic acid gradually lightens hyperpigmentation. Results take 4 to 8 weeks of consistent use. Kojic acid is generally well tolerated but can cause mild irritation in some individuals. Hydroquinone is a prescription bleaching agent highly effective for hyperpigmentation. It directly inhibits melanin production. Prescription hydroquinone typically ranges from 2 to 4% strength, applied twice daily to affected areas. Results appear within 4 to 12 weeks. However, hydroquinone should not be used continuously for more than 3 to 4 months without medical supervision, as extended use can cause paradoxical darkening or an uncommon condition called achronosis. Hydroquinone is not suitable for everyone and requires dermatologist prescription and monitoring. Chemical peels accelerate PIH resolution. Superficial peels with glycolic acid or salicylic acid remove pigmented surface skin, revealing lighter skin underneath. Monthly superficial peels combined with daily topical treatments significantly accelerate PIH fading. Medium-depth peels provide more dramatic but riskier results and are typically only performed for severe PIH. Laser treatments effectively target hyperpigmentation. Q-switched lasers are specifically designed to break up melanin pigment, with different wavelengths targeting different pigment depths. These treatments provide results in 4 to 6 sessions, sometimes fewer for responsive PIH. However, laser treatment is expensive and carries risks of complications in darker skin types. IPL, intense pulsed light, therapy also addresses pigmentation effectively. Microdermabrasion physically removes pigmented surface skin through mechanical abrasion. Performed monthly, combined with topical treatments, it accelerates PIH resolution. However, it's less powerful than laser treatments and typically requires more sessions. Combination approaches yield best results. Most dermatologists recommend combining daily topical treatments, vitamin C, azelaic acid, or hydroquinone, with monthly professional treatments, chemical peels or laser. This dual approach treats PIH from multiple angles, achieving faster, more complete resolution. Acne scarring is a more permanent complication than PIH. Scarring results from significant inflammation destroying collagen, resulting in physical indentations or elevation of the skin. There are 3 main types of acne scars: ice pick scars, deep, narrow indentations; boxcar scars, wider, flat-bottomed indentations; and rolling scars, wave-like depressions. Prevention is the most effective scar treatment. Avoiding picking, squeezing, or extracting pimples prevents scarring. Treating acne aggressively prevents deep inflammation that causes scarring. Taking acne seriously and treating it promptly prevents severe scarring. For existing scars, multiple treatment options exist, possible. The goal is significant improvement. Topical treatments are largely ineffective for true scarring, as scarring involves structural damage that topical products can't reverse. However, improving overall skin texture and treating associated hyperpigmentation can make scars less noticeable. Subcision is a minor surgical procedure where a needle is inserted under the scar, breaking the fibrous tissue causing the depression. This allows collagen to regenerate and fill the scar. Subcision works best for rolling scars and tethered scars. Results appear gradually over 6 to 12 months as new collagen forms. Laser resurfacing removes thin layers of skin, smoothing scars. Fractional laser resurfacing is less aggressive than full resurfacing and requires less downtime. Multiple oral antibiotics don't significantly affect athletic performance at prescribed doses. Athletes can safely use oral antibiotics for acne without worrying about performance impacts. Spironolactone, if used by female athletes, is not banned in professional sports and doesn't directly affect performance, though it's a diuretic potentially affecting hydration. Athletes using spironolactone should ensure adequate electrolyte and fluid intake. Isotretinoin doesn't affect athletic performance. However, during isotretinoin treatment, skin is photosensitive and sometimes irritated, which might temporarily affect comfort during training. Otherwise, no performance impact. Retinoids don't directly affect athletic performance. Some concerns about sun-sensitizing acne treatments affecting outdoor athletes are legitimate. Sun-sensitizing treatments require extra sun protection for outdoor athletes. Using high SPF sunscreen that's sweat-resistant and reapplying frequently is necessary. Anxiety about acne potentially affecting performance is psychological rather than physiological. If acne causes confidence loss that affects athletic performance, treating acne improves performance through psychological mechanisms. Conversely, improved mental health from treating acne often improves athletic performance. The overall effect of treating acne in athletes is typically positive. Improved mental health, confidence, and well-being generally improve or maintain athletic performance. Guide 73, Acne Treatment Costs, Insurance Coverage, and Affordable Options. Cost of acne treatment varies dramatically based on treatments selected and whether insurance covers them. Understanding costs and coverage options helps make affordable choices. Over-the-counter topical treatments, salicylic acid, benzoyl peroxide, retinol, cost $5 to $30 per product and are usually affordable. These are often effective for mild to moderate acne. Prescription topical treatments, tretinoin, adapalene, azelaic acid, cost $20-$100 plus per month depending on insurance. Generic versions are often affordable, brand name versions cost more. Oral antibiotics, doxycycline generic, cost $10 to $30 per month typically, making them affordable. Oral isotretinoin can be expensive, $200-$500 plus per month, even though the generic is relatively affordable. However, insurance typically covers isotretinoin for severe acne, bringing costs down significantly. Without insurance, isotretinoin can be prohibitively expensive. Spironolactone generic is inexpensive, $10 to $30 per month, making it affordable. Oral contraceptives for hormonal acne range from $20-$100 plus monthly without insurance, though many are quite affordable. Insurance typically covers at least some options. Professional treatments, chemical peels $150 to $300, laser $400-1000 plus, microneedling $200 to $400, are expensive and insurance rarely covers them. However, they might be worth pursuing if home treatment's insufficient. Insurance coverage varies widely. Some insurances cover prescription acne treatments generously while others cover minimally. Checking your insurance coverage for your specific treatments helps plan. Dermatology visits cost $100-300 plus without insurance. Some dermatologists offer sliding scale fees for uninsured patients. Community health centers often provide affordable dermatology care. Affordable acne management strategies. Start with over-the-counter treatments. Use generic prescription medications if needed. Ask dermatologists about patient assistance programs for expensive medications. Consider community health center dermatology if cost is barrier. Check insurance coverage before treatments. Many effective acne treatments are affordable. Cost shouldn't prevent access to basic acne treatment, though advanced professional treatments may be limited by budget. Guide 74. Traveling with acne and maintaining treatment consistency. Travel disrupts routines, and changes in water, climate, and environment sometimes affect acne. Planning ahead helps maintain acne treatment consistency while traveling. Packing acne treatments. Bringing full-size bottles takes space and weight. Travel size containers, available at most pharmacies, help. Decanting products into smaller bottles also works. Ensure all liquids comply with airline regulations if flying. Jet lag affects sleep quality and can worsen acne through stress and hormonal disruption. Prioritizing sleep adjustment and jet lag management helps minimize acne worsening from travel. Different water quality in travel destinations affects skin. Hard water or heavily chlorinated water might irritate skin. Using bottled water for rinsing face, or adapting cleansing to account for different water, helps minimize water-related skin issues. Different climates affect acne. Traveling to humid climates from dry climates or vice versa might temporarily worsen acne as skin adjusts. Using moisture-appropriate products for the destination climate helps. Stress from travel worsens acne. Stress management during travel, exercise, meditation, sleep prioritization, helps manage stress-related acne worsening. Maintaining routine is important. Even if traveling, continuing your acne treatment routine helps maintain clarity. Making treatment part of your travel routine, like packing it with toiletries, helps ensure consistency. Some travelers experience travel acne from new environments, water, or stress despite normally clear skin. Understanding this is temporary and will resolve upon return helps maintain perspective. Professional treatments aren't practical while traveling. Continuing topical treatments and avoiding new triggering factors is realistic goal during travel. If traveling long-term, weeks or months, establishing local dermatology care if treatments need refilling helps maintain continuity. Guide 75. Acne in specific professions, pilots, surgeons, healthcare workers, and others. Certain professions have acne-promoting environmental factors. Understanding profession-specific acne factors allows appropriate prevention. Pilots and flight crew experience repeated altitude changes, cabin air pressure, dry air, and frequent travel jet lag, all acne-promoting factors. Additionally, time zone changes disrupt sleep and stress levels. These workers benefit from aggressive acne prevention and hydration strategies. Surgeons and healthcare workers wear masks for prolonged periods, creating occlusion and friction-related acne under masks. The pandemic increased mask-related acne awareness. Prevention includes mask breaks when possible, changing masks frequently, keeping skin under mask clean and dry, and using non-comedogenic products. Chefs and kitchen workers are exposed to heat, steam, and splashing from cooking, increasing sweat production and skin irritation. Heat exposure worsens acne. These workers need frequent face cleansing and good ventilation when possible. Outdoor workers, construction, landscaping, etc., experience sun exposure, heat, dirt, and sweat, multiple acne-promoting factors. Aggressive sun protection and sweat management are important. Office workers with high stress loads might experience stress-related acne. Stress management helps. Sports coaches and trainers are often in hot environments with sweat and frequent manual labor. Prevention strategies similar to athletes apply. Makeup artists and beauty professionals might have acne from product exposure or allergic reactions. Using quality, non-comedogenic products and maintaining clean equipment helps. Understanding your profession's specific acne-promoting factors allows targeted prevention. Many occupational acne factors can't be eliminated, can't stop wearing masks as healthcare worker, can't avoid heat as chef, but adapting treatments and prevention to account for occupational factors helps maintain clarity. Guide 76, Acne Myths and Misconceptions, Separating Fact from Fiction. Numerous myths about acne cause misinformation and sometimes harm. Understanding common myths helps you avoid misinformation affecting your treatment. Myth: acne results from poor hygiene. Fact: acne isn't caused by dirty skin or poor hygiene. Gentle cleansing is important, but over-cleansing worsens acne. Acne results from follicular occlusion, sebum production, bacteria, and inflammation, not dirty skin. Myth: chocolate causes acne. Fact: chocolate itself doesn't cause acne. However, high-sugar foods, which chocolate often contains, might worsen acne in some individuals through blood sugar and insulin effects. Myth: greasy foods cause acne. Fact: eating fatty foods doesn't directly cause acne through dietary fat transfer to skin. Excess calories from any source might contribute to inflammation and acne, but greasy foods specifically aren't acne-causing. Myth: acne will go away on its own eventually. Fact: some acne improves with age, but many people experience persistent acne requiring treatment. Waiting for spontaneous resolution wastes years. Myth: toothpaste treats acne. Fact: toothpaste isn't appropriate for acne and contains irritating ingredients. While older formulations sometimes contain benzoyl peroxide in tiny amounts, modern toothpastes shouldn't be used on skin. Myth: picking acne helps it heal. Fact: picking worsens acne, spreads bacteria, increases inflammation, and dramatically increases scarring risk. Never pick acne. Myth: sunlight cures acne. Fact: while temporary UV-induced drying might make acne appear better briefly, sun exposure actually worsens acne long-term through inflammation and post-inflammatory hyperpigmentation. Sunscreen is essential, not optional. Myth: all makeup causes acne. Fact: while some makeup clogs pores, many non-comedogenic cosmetics don't worsen acne. Appropriate cosmetic selection allows makeup use without acne worsening. Myth: acne only affects teenagers. Fact: adult acne is extremely common and can be more severe and treatment-resistant than teenage acne. Understanding that these myths are false prevents ineffective or harmful behaviors based on misinformation. Guide 77: Acne Treatment Resistance and When to Escalate Care. If acne doesn't improve despite appropriate treatment, several possibilities exist. Understanding why treatments fail helps guide next steps. Noncompliance is the most common reason treatments fail. Using treatments inconsistently, not using them as directed, or expecting results before adequate trial time has elapsed appears as treatment failure. Ensuring 8 to 12 weeks of consistent use before concluding treatment failed is important. Incorrect treatment selection for your acne type causes apparent treatment failure. Using treatments inappropriate for your acne type, for example, using salicylic acid for primarily inflammatory acne when benzoyl peroxide would be better, results in inadequate response. Inadequate treatment strength or frequency might result in insufficient improvement. Increasing frequency or concentration, appropriately, not aggressively, sometimes converts inadequate response to good response. Combination of multiple acne factors not addressed by your current treatment might cause inadequate response. Adding treatments targeting different factors improves outcomes. Underlying conditions, PCOS, other endocrine disorders, infections, causing acne might not be addressed by topical treatments. Seeking professional evaluation for underlying causes is appropriate. Barrier compromise from overuse of strong treatments sometimes appears as treatment failure, constant irritation rather than improvement. Taking a barrier repair break and restarting with gentler approach helps. When to escalate care: if single topical treatments haven't produced adequate improvement after 12 weeks, if your acne is moderate to severe from the start, if you have signs of hormonal acne, if you have deep cystic lesions, if acne is